For my presentation topic, I chose Tourette syndrome, a comprehensive overview, understanding the disorder, its impact, and management. What is Tourette syndrome? The definition of Tourette syndrome is a neurological disorder characterized by repetitive, involuntary movements and vocalizations called tics. Classification: part of a group of tic disorders. Onset: symptoms typically appear between ages 5 and 10. Types of tic: you have motor tics, eye blinking, shoulder shrugging. You have complex tics, coordinated movements like hopping or twisting. And then you have vocal tics, simple throat clearing, grunting. Complex, repeating words or phrases, sometimes including inappropriate language. Causes and risk factors: genetic predisposition often runs in families, neurochemical imbalances involving dopamine and serotonin, environmental factors, stress or infections may exacerbate symptoms. Diagnosis and symptoms. Diagnosis based on a clinical observation of tics persisting for over a year. Symptoms: waxing and waning of tics. Premonitory urges, sensations preceding tics. Co-occurring conditions like ADHD or OCD. Impact on daily life. Challenges: social stigma, difficulty concentrating, and emotional stress. The strengths: many individuals with Tourette syndrome excel in creativity and problem solving. Treatment and management. Behavior therapy. Habit reversal training. 2. Medications for severe cases such as antipsychotics or VMAT2 inhibitors. Support systems: family, school, accommodations, and peer support groups. Myths and facts. A myth about Tourette syndrome is all individuals with Tourette's have coprolalia. A fact is only a small percentage experience this symptom. Myth: Tourette syndrome affects intelligence. Fact: Tourette syndrome does not impact cognitive abilities. Raising awareness. The importance of understanding and empathy, and advocacy for inclusive environments in schools and workplaces. In conclusion, Tourette syndrome is a complex neurological disorder that typically begins in early childhood, most often between the ages of 5 and 10. It is primarily characterized by the presence of tics, which are sudden, rapid, and involuntary movements or vocalizations that occur repeatedly. Tics are generally classified into two types: motor tics, which involve body movements such as blinking, facial grimacing, head jerking, shoulder shrugging, and vocal tics, which involve sounds like throat clearing, grunting, sniffing, or the repetition of words or phrases. These tics can be simple, involving a single movement or sound, or complex, involving multiple coordinated movements or longer vocalizations. The exact cause of Tourette syndrome is still not completely understood, but research suggests that it is influenced by a combination of genetic, neurobiological, and environmental factors. It often runs in families, indicating a hereditary component. Although Tourette is primarily a tic disorder, it is commonly associated with other neurodevelopmental or psychiatric conditions, including attention deficit hyperactivity disorder, obsessive compulsive disorder, anxiety, and learning disabilities. These co-occurring conditions can sometimes pose greater challenges than tics themselves. Tourette syndrome is diagnosed based on clinical criteria, with the key requirement being the presence of both motor and vocal tics that persist for more than 1 year. There is no single test for diagnosing this disorder. The severity and frequency of tics can vary wide between individuals and may also fluctuate over time. While tics often worsen during periods of stress or excitement, they typically improve with age, and many people see a significant reduction in symptoms during adolescence or early adulthood. Treatment for Tourette syndrome depends on the severity of symptoms. In many cases, when tics are mild and do not interfere with daily life, treatment may not be necessary. However, when tics are severe or disruptive, behavioral interventions such as comprehensive behavior intervention for tics or habit reversal therapy can be effective. In more challenging cases, medications such as antipsychotics, agonists, or other neurological drugs may be prescribed to reduce tic severity. In addition to treatment, education, family support, and accommodations at school or work can play a vital role in improving the quality of life for individuals with Tourette. Importantly, Tourette syndrome does not affect intelligence or life expectancy, and with the right support, most individuals with Tourette's are able to live healthy, successful, and independent lives. Public awareness and understanding are essential in reducing stigma and helping those with Tourette syndrome feel accepted and supported in their communities.